Hello everyone, welcome back to my channel. The COVID-19 viral disease has swept into 156 countries and killed more than 6,000 people. How do we prevent it spreading? To study this problem, I have worked out a pandemic simulation in the last few days. I used Gaussian distribution to simulate population distribution and their movements, so we can visualize this outbreak process and learn from it. If you like my video, welcome to subscribe my channel and share it with your friends. Before we go into the simulation, let's think about what factors can have impacts on the outbreak of a virus. The first thing coming to your mind might be virus infectivity. If a disease is not contagious, it cannot develop into a pandemic at all. The second factor is virus fatality rate. If nobody dies from it, it's not that scary and we don't need to worry about it. Third, the cure rate. Since there is no specific medication for the novel coronavirus yet, whether a patient can recover heavily relies on his or her immunity. Here I will introduce the cure rate to determine the probability a patient can be cured. The fourth factor is hospitals' capacity. How many hospitals are there in a city? And how many empty beds a hospital can provide. The factor is also very important as it indicates whether every patient can receive treatment when the disease goes viral. The last factor is people's activity frequency. By saying that, I mean how often each person interacts with the others. In reality, there might be more factors contributing to the viral transmission and to the disease control. In my simulation, let's start from here and expand our model if necessary. Now let's go to the program to set up simulation details. In my simulation, the city is 1,000 by 1,000 square, and 5,000 people are living in the city. 5 of them are carrying the coronavirus initially. What's the virus infection rate? The recent news stating a 56-year-old Chinese man catches coronavirus in just 15 seconds after standing next to an infected woman in a market. Due to its high infectivity, I take the infection rate as high as 95%, conditional on a certain safety distance. According to COVID-19 statistics when I make this video, the fatality rate is about 3.8%. Death time is defined as the average time from confirmed to death. Incubation period is about 14 days. I define two types of cure rate and cure time here. People in hospital are receiving a better treatment. The cure rate is around 40% and average cure time is 20 days. When the hospital is full, some patients can also recover themselves with the help of their immune system. But this natural recovery has a lower cure rate and longer cure time, so we define it as 10% and 40 days respectively. All the cure time and death time obey the Gaussian distribution. Activity frequency refers to the probability a person interacts with others outside home. It varies from 0 to 1. 0 means nobody moves and everybody stays at home. 1 means everyone is moving all the time. So I take 0.99 here to mimic a normal society before the pandemic. Safety distance is the minimum distance between two people to avoid getting infected. I take 2 units as safety distance in my simulation. Hospital beds capacity is hard to set up since it varies in different cities. Here I take an average from the top 40 highest hospital bed density countries. The result is 35 beds for 5,000 people. Considering this data also includes people living in countryside, I take 100 beds here for the city in my simulation. I assume that confirmed patients are randomly admitted to enter the hospital. So let's see how the simulation goes. In the simulation, each white dot represents a healthy person. Each yellow dot is a virus carrier in 14 days incubation period. Red is confirmed patient, green is cured patient, and black is dead patient. Hospital is represented by the blue box. We can see that the hospital is filled up with patients quickly and becomes full after 7 to 8 days. Patients in hospital are safely quarantined. We can see from the simulation that death appears after about 10 days. After 20 days, about 40% of patients in hospital are cured. Cured patients will exit hospital and return back to the community. After 40 days, some patients recover naturally. In the meantime, the number of healthy people is declining rapidly. After 90 days, about 94.3% population has been infected and 3.5 people died. Now let's change the hospital beds capacity from 100 to 5,000. Everyone in the city will have a bed in hospital. This time, hospital is also filled up quickly in the beginning, but it starts to slow down as most patients are treated and quarantined in the hospital. 3 months later, only 62% population has been infected and 2.3% people died. This number is greatly reduced from the last simulation. That is to say, with sufficient medical resources, the disease will be under control given some time. So it is not hard to understand why Chinese government decided to build 2 emergency specialty field hospitals at Wuhan in response to the outbreak, which are designated to isolate the COVID-19 patients. And the first one, Huoshenshan Hospital, was completed in 10 days and started taking confirmed patients from February the 4th, and the second one, Meishenshan Hospital, started operation 4 days later. The 2 hospitals together provided more than 2,600 beds, relieved pressure on Wuhan overburdened healthcare system while controlling the spread of the deadly virus. Now let's revert hospital beds capacity back to our original setup, 100, but change the activity frequency to 0. Let's see how it goes. Nobody moves in this simulation. The confirmed patients are transported to hospital to receive treatment quickly. After 1 month, only 0.1% population are affected by the virus and 1 person died. The result is amazing as it tells exactly how important of low activity frequency and why it helps to quarantine confirmed patients. This is also the reason more and more companies are asking their employees to work from home if possible. When the pandemic comes, the biggest contribution we can do to the society is to stay home and reduce activity frequency. Coronavirus is spreading globally. No country can stop the outbreak alone. We are in this fight together. The simplest contribution everyone can do is to staying at home. Thanks for watching my video. If you like it, please share it with your friends and subscribe to my channel. If I can get 500 subscriptions, I will build a website with this simulation model embedded so that everyone can play with it by changing the parameters freely and see how the result changes. Okay, see you next time.